Thank you guys so much for tuning in to the Better Today, Healthier Tomorrow podcast. I'm your host, Ryan Howard. Today we're going to be getting the opportunity to sit down and chat with one of our brilliant researchers, Dr. Taren Swindle. Today we're going to be getting the opportunity to discuss how ACRI and ACNC partner with families in the community to help conduct research to help improve the health of children around the state of Arkansas and beyond. So first, Taren, how are you doing today?
I'm doing well. Thank you so much for having me.
Thank you so much for taking the time out of your schedule and come down and see us. So before we actually get into the interview, if it's not too much trouble, can you take a second and explain kind of what your role entails for the people at home?
Absolutely. I kind of wear two hats here at Arkansas Children's. One is I was a researcher myself. I lead research projects that take place in community settings and have so much fun doing that. And the second hat that I wear is as the director of the Link, and that is a community engagement core of the Arkansas Children's Research Institute. So in that role, I get to help other researchers do their work, mentor them in how to do community engaged and implementation science practices, and support other faculty's research.
Man, that's so awesome, man. You got such a cool job.
It is pretty cool. I love it.
So another thing for the people at home that may not necessarily be familiar with what Arkansas Children's Nutrition Center or the Arkansas Children's Research Institute does, can you kind of explain what they do and how they work with one another?
I can. So the Arkansas Children's Nutrition Center is one of only two of its kind in the entire country. So the United States Department of Agriculture funds these centers of excellence for human nutrition research. And there's about 8 of those across the country. But again, only 2 focus on children. So we've got one of those right here in Arkansas. So it's pretty special. So Arkansas Children's Nutrition Center lives under the umbrella of the Research Institute, where people do research on all sorts of topics, asthma and cancer, promoting cancer care for children, and obesity-related research. It's just very broad what those research investigators do, and then the Nutrition Center lives under that umbrella.
Man, that's so awesome. I think that's so cool, and it's such a big deal that we have something like that here in Arkansas, man. I think that's just amazing that we provide that service that we have here.
It's very special.
Man, it is. So another question, I guess, how does ACRI and ACNC directly connect to improving children's health across the state of Arkansas and beyond with this work?
Yes, in a few ways. And again, I'll talk a little bit about my work personally, and then also about the work that I do with other investigators. So one way is by doing research that reaches all parts of our state. So I have a study, for example, that's live right now, and we're in over 110 childcare sites in Arkansas and Louisiana. And we're getting to implement an evidence-based intervention in all kinds of programs in rural parts of our state where children are getting access to evidence-based promotion of fruits and vegetables. It's very exciting. So we do it, one, through direct intervention or direct research studies and programming out there where people are living. We also do it by conducting research here on campus that ends up impacting practice out there in the everyday real world. So for example, there might be folks here that are doing studies on specific dietary patterns or movement patterns that we learn about, the benefits, for example, and then we teach others in the state about those benefits, maybe nurses or other families or doctors, and who can then get that information out to more families. So those are a couple of the ways that we have statewide impact here.
Man, that's awesome. You said something where you kind of gave those few examples of research, and I feel like I want to double down on that because I think before we actually started the podcast, I was telling you how I had a conversation with you a while ago, and it completely changed the way that I view research. Like for me, I thought that research was just like a bunch of people in long white coats and beakers and all that stuff, magic potions and all that other kind of stuff. But research is so much more than that. So for the folks at home that may have thought about research the way I did, can you kind of go more in depth in explaining all the types of research there is and what research looks like?
I absolutely can. And just to build on what you're saying, researchers don't all wear lab coats. I've never put one on.
Oh, man.
I am a researcher and I've been doing this for about 15 years. And we don't all look a particular way. And I'm an Arkansan. We are normal people. And so that's really fun for you to bring out. We think about research as it exists across what we call the translational spectrum. And there are 5 levels of that spectrum. I won't bore people with the details, but Really, in a nutshell, at the far end of the spectrum, you have the kind of research that you've just described, the kind with the lab and the microscopes and that really specific, they call it bench science. And then as it moves across that spectrum, you start to do studies in humans, or what we might call clinical trials. And then you start to do the real world studies, what we might call translational trials or implementation science trials, where we try to change everyday practice. So my research takes place in early care and education settings, or schools, or workplaces. So it doesn't look like just like one thing. It is all of those things.
Man, that's so cool. I like that you explain all that, because it brings me to this point where it's like, a lot of times when you look at research, like with people having the coats and stuff, it seems like a lot of people will probably be hesitant to participate in it because it's almost like you feel like, man, I'm a subject, like a research subject and not a partner. But something I think is so beautiful about the way you describe it, and what I've seen from you guys' work, is that you guys are making these families and participants in the research partners and not subjects. Can you kind of describe, like, if we went in depth on that, can you describe what you guys kind of do to make sure those families feel like partners and not subjects?
Yes, you're picking up on something that's really important, which is that in the past, research, not just here in Arkansas, but I mean across the country, across the globe, it was done on children and families, not with children and families. So that what you're calling out, that different model, that partnership model, is really important to us. So we try to involve family perspectives and community partner perspectives in all aspects of the research design. They help us think about how we might approach people to participate in research. They help us think about what's appropriate compensation for someone to be involved in research. How do we be clear in all of our materials about what folks are committing to and what that means for them? And then how do we share our data back in a way that is honest and transparent about the process that they helped us engage in? So those are key examples where we want people's voices at the table. We want to hear what their real day-to-day lives are like, so that we're designing research studies that can fit.
Man, that's cool. So, like, doubling down on that, like, are there any specific things that you guys do to make sure that those participants and those families feel like informed and comfortable, and make sure that they feel heard throughout the process? Are there any specific things that you guys make sure that you do with each interaction to make them feel that way?
Yes. So we have a lot of our studies have advisory boards. And so the advisory boards serve to provide specific input on those elements that I just described, but they also give that input throughout the research study. So if we are having a challenge with one of our studies, or let's say a recruitment problem, nobody wants to participate, we take that to our advisory board and they say, well, it's because you haven't thought about what it's like to live in this county. And they give us really concrete feedback to honor the perspectives of those that live in that area or with that condition or in that population, so that we're centering them up front. So advisory boards are one of the key ways that we do that. Another is ongoing partnerships. We don't want our partnerships with folks in the community to be just one time or just about one study. We try to show up when things are happening in the community. So we have many community organizations that will invite us out when they're going to do a ribbon cutting, or they've got a health fair that's going on, or maybe a new initiative in their community. We want to show up so that we have ongoing opportunities to build a relationship that is real with our partners. Head Start is an example for me. I've been doing research with our Head Start here in Pulaski County for over a decade, and we show up for each other. If I want their input on a Head Start related issue, I know I can reach out for them. And if they want me to help support an event they're having or professional development needs that they have, we want to honor that as well. So it is ongoing engagement too.
That's so cool that's so awesome hearing that, and hearing that those families kind of have like a say in how things kind of go. Why do you think it's important that families are able to give that input to help shape the research about their own health, children, and communities?
Yeah. Well, I am one person. Every researcher here on this campus is only one person with one perspective, and that is not enough perspectives to do a good job. We need those additional voices at the table to tell us when we're not being realistic. An example from some of the work that I was doing coming out of the pandemic, we were doing online data collection for a project, and we had teachers come to us and say, we had to do online during COVID. We're so tired. This is not going to work for us. And we were able to hear that perspective, and we were making an assumption, well, everyone learned how to do these things. We must be trucking right along now with online tools. And our perspective was really, really appropriately corrected by their real world experience.
And that's cool. It's like I feel like you've answered this next question without me even having to ask it. But like that developing trust, I think, with the families, and like I feel like having that openness helps you guys with develop that trust. But like if you could kind of speak about like how does ACRI and the Nutrition Center build trust with families and communities, and especially the ones that may not have any type of experience dealing with research? Like how do you guys go about building that trust with them?
I'll double down on a couple things I already said and add on it. So we do those advisory boards. I recommend every study have a study-specific advisory board that includes parents, youth of age when appropriate, other experts in the field, like for me, that's teachers, things like that, that advise on their study. We also want partnerships to be long-term, not short where they come in and come out. We really encourage researchers to keep things going long-term. And then we offer through the link at ACRI a couple of concrete examples that bring community members to the table, which I love to share about. One, we have what we call the community experience and academic experience tours. We are actually we've just finished our academic experience. We brought community members to campus and said, hey, let's show you around our labs. Let's listen to researchers and allow you to have opportunity to connect and network with them and ask them questions. And we spent a whole day just allowing community members into our spaces where they could feel comfortable and feel like they had an opportunity to explore. We also do what we call coffee conversations, and we invite either a community member or a researcher can request one of these. And they contact us and let us know, hey, I want to talk with a community member or researcher about this topic, and would you sponsor that? And we're like, yeah, we'll buy you a cup of coffee to sit down and talk about that. So we want people to have access to researchers. We really feel like it's important. One of my visions is that every Arkansan would know a researcher and have an opportunity to ask science questions to people that are in the know and can kind of demystify it. It's not a black box. It doesn't have to be.
I know y'all probably have like a lot of people come in for like when you're doing research, you probably have like a pretty diverse group of people that you're dealing with to get information from different areas of Arkansas. Like what steps are taken to ensure that families involved reflect the diversity of Arkansas?
I mentioned we're currently in over 110 programs. So when we set up our research studies, we are really intentional to say we're going to balance our recruitment across geographic regions of the state. We're going to make sure that we are recruiting a certain mileage out so that we're getting that representation. We don't want just folks in Central Arkansas to have access to research. Now with the additional clinics that are coming open across the state, we've got opportunities to spread and partner more and more. So those are some of the things that we're looking at.
Nice. And I know sometimes with research, like a lot of times when you doing that, you may not be able to find data right away for some of the studies and things that you do, but for the ones that you are able to, how are you guys able to translate, how are you guys able to translate research findings back to families in ways they can actually put to use?
Yes, I have two examples on this one. So the first is we have a study called Community Expecting, which does exactly what you've just said. It was a clinical study here at Children's Campus where all the participants had to come here for their intervention in the research study. And now we've, with community input, adapted that program for community-based delivery. We've trained people in the community to deliver the intervention, and we allow people to access it where they live. And that is one of the ways, too, you asked about statewide impact, that we're seeking to have more statewide impact because we've got program here in the central part of Arkansas, but also in Pine Bluff. We're going to be expanding to other parts of our state so that people can access that study closer to where they live.
Oh, man, that's awesome. I feel like that's a really good segue into my next question when you're talking about people collaborating. Because I imagine with research, it almost has to be a holistic, like all hands on, a holistic approach, all hands on deck approach between like ACRI, ACNC, the doctors, community partners, and people all over the state. Like, what does that collaboration kind of look like? I imagine that's what's going on, but what does that look like?
Yes, it cannot be underestimated. It requires a lot of complexity and a lot of intention. We do things with our community partners where we sit down at the beginning and say, hey, this is what we're expecting to give. What are you expecting to get? This is what we are expecting to get. What are you expecting to get? So we have to kind of go slow to go fast. We have to slow down a lot of times when we're starting a new project, making sure that everybody feels like, okay, I've been heard. We're clear on what I need to do and what I'm going to get in return. And that's been really helpful for us. I want to circle back to your prior question because I didn't give you my second
Oh,
example.
I'm sorry.
That's
Forgive.
quite all right. One of the other things that we do is we try to make sure that we're giving results back in a timely fashion in a way that they can use. So that Head Start project that I told you about, we do what we call cost reports where we give them right back to the site and say, this is the value of the partnership that you've received from us this year. And then they are able to put that in their subsequent grant applications to help them get refunded. So that's a request that they made of us that we could honor, and we were able to do that and turn that information back to them.
Oh man, that's so awesome, man. And I want to ask this. This may be too much to kind of get an answer on that, but like, what are some of the biggest child health and nutrition challenges you see facing Arkansas families right now?
Yes. Access to healthy food is not the same in every county. So where you live is really driving sometimes the availability and the types of food that you can get. And I've worked with schools in rural counties to do our fruit and vegetable program. And they say, well, I don't have a vendor that will sell that to me here, or it's going to cost me 2 to 3 times more. The prepackaged snacks are so much more affordable for where we are in our state. Which is always shocking to hear. We live in an agricultural state where you would think that it's pretty easy to get fruits and vegetables, but it's quite untrue. And so I think access is one of the biggest issues that we face here in Arkansas.
Oh man, thank you. Man, so I want to shift gears just a little bit because something I always like to do when on this podcast, I always like to highlight our awesome staff and like give the people at home opportunity to see like, man, we have like some really brilliant people here, and just kind of, I like to ask a few questions to allow people to get to know you a little bit better. So my question for you, I feel like, I don't know, my first question for you is why research? Like, why did you decide to get into this and say, hey, you know what? I think I want to learn about stuff and explain it to people. What made you decide to go down that career path?
Yes. Well, learning is my favorite thing to do. And that was really fostered in me as a child. And I have people in my life that have poured into me just an excitement and a passion to learn. So when you do research, learning is your job. I get to ask questions for a living and then design ways to answer those questions, get the answers, and impact children's health. So that's it for me. I get to learn for a living. Pretty exciting.
And another thing, why Arkansas Children's? I mean, you could go do research anywhere. What makes you want to stay here and do that?
Thank you. I love Arkansas. I am an Arkansan, as I mentioned, 8th generation, and I come from a farm family in Northeast Arkansas, and it means a lot to me to be able to give back to our state and to stay here and invest in children.
All right. And what do you hope, like you do a lot of stuff, you do a lot of work. What do you hope, how do you hope that the work that you're doing, what impact do you want the work that you're doing to have on the kids of Arkansas like 5 and 10 years down the line?
Thank you. I want every child in Arkansas to have access to evidence-based movement and nutrition programs in their childcare and their school settings. Every child.
All right. And then 2 more questions. I feel like I've asked you this before, but I feel like you do such a good job with answering it. For the parents at home that are thinking about being involved in research projects, like, why do you think that they should participate in the programs and things that we have here?
Yes. It contributes to the greater understanding of what is driving child health, which won't solve all of our problems today, but also gives us a better chance tomorrow as the title of this podcast suggests, that if we can keep building on that knowledge base, we can do better generation by generation. So it's like paying it forward to your children, to your grandchildren, to help us know more about why things are the way they are and what we can do to make them better. And that is going to pay it forward.
All right. Well, man, Dr. Swindle, thank you so much for taking time out of your very busy schedule and coming down here and chatting about all the awesome things that you do and all the awesome things that you guys have cooking over there. I know that the people at home appreciate all of that. So I just want to thank you on behalf of everyone for doing what you do to help to make the kids of Arkansas better today, healthier tomorrow. Thank you guys so much for taking time out of your schedule to watch this. If you guys found this information meaningful or helpful, please make sure to like this, drop a comment, and share it. Until next time, you guys stay encouraged.